Good afternoon, everybody, and welcome to TCPalm's daily 2 p.m. Coronavirus Q&A. I'm Columnist Gil Smart here. It is Thursday, April 9th, and let's get right to the numbers. Right now, there are a total of 309 confirmed cases of COVID-19 on the Treasure Coast. That breaks down as follows. 68 cases in Indian River County, including 50 in Vero Beach, 5 in Sebastian, and 1 in Fellsmere. 132 cases in St. Lucie County, including 101 in Port St. Lucie and 28 in Fort Pierce, and 109 cases in Martin County, including 56 in Stewart, 21 in Palm City, 14 in Hobe Sound, 8 in Jensen Beach, 7 in Indiantown, and 1 in Jupiter. It's an interesting dynamic here. Again, St. Lucie County has 132 cases. Martin County has 109 cases. St. Lucie County's population is almost 3 times that of Martin County. So the number of confirmed cases per 100,000 residents is significantly higher in Martin County than it is in St. Lucie County. Statewide, right now, we've got a total of 16,364 cases, 354 deaths. Martin County saw its first death from COVID-19 yesterday. A 77-year-old man who did not have a recent travel history and did not have contact with anyone who tested positive for the virus passed away. He became the 7th person on the Treasure Coast to have died from the virus or died with the virus. The previous 6 have all been from St. Lucie County. But let's have a little bit of good news here. The key metric or model being used by the White House and others to predict the impact of the virus has recently been revised to reflect some better news. The Institute for Health Metrics and Evaluation at the University of Washington School of Medicine now predicts Florida's surge in cases will occur earlier than expected, and the death toll is likely to be lower than initially feared, and our hospitals are unlikely to be overwhelmed. The new model reflecting the new data now predicts a mean estimate of 4,357 deaths through August 4th. That's still a lot, folks. Or the first wave of the disease. In other words, there's going to be additional waves of the disease. But the previous prediction was a mean of 6,770 deaths in the first wave. Of course, there's a significant margin of error, and if we all let our guard down, these numbers are only going to get worse. To whatever extent we're seeing a flattening of the curve, people are attributing it to social distancing and the fact that we've got the state lockdown now, and people are actually beginning to respect this, to some extent at least. And then with another 6.6 million people filing first-time unemployment claims this week, here's some better economic news. Millions of Americans could begin to get their stimulus checks over the next few days, as soon as today or tomorrow, in fact, in some cases, for people who have already given their bank account information to the Internal Revenue Service for direct deposit of tax refund. Let's start with a question about something that occurred yesterday. As we talked about yesterday, the first grocery store employee on the Treasure Coast was diagnosed with the virus. A worker at the Martin Downs Publix in Palm City in Martin County was diagnosed with the coronavirus. Again, becoming the first case among grocery store workers on the Treasure Coast. Around the country, more and more grocery store employees are coming down with the virus. What happens when this happens? What does the store or the company do? Several Publix employees throughout Florida have tested positive. In addition to the case in Palm City, I found stories out of Miami Lakes, Coral Gables, Boca Raton, Dunedin, and Tallahassee, among other places. Store officials say when this happens, the employee who tests positive is quarantined and granted paid leave for 14 days. And the same is done for any employee who's been in close contact with that associate. I guess, theoretically anyway, the store's going to do a deep clean after this, but the stores are supposed to be doing deep cleans every night anyway, constantly, that sort of thing. An interesting aspect of this is now that Publix is allowing associates the option of wearing face masks and gloves after previously forbidding them. We had gotten some anonymous notes from Publix employees a week or so ago, maybe a few weeks ago, saying they wanted to wear masks and gloves, but they were prohibited from doing so. They were told that they couldn't. But now, in Miami Beach, which has 4 Publix stores, the city issued an emergency order requiring customers and workers to wear face coverings at grocery stores, among other places. And this is kind of a no-brainer, isn't it? Grocery stores are like the one place that people congregate en masse during this whole virus crisis. They remain open for obvious reasons, and more shoppers are beginning to take precautions and wear masks and gloves, bring disinfectant wipes, that sort of thing. why aren't grocery store workers not just encouraged but required to wear masks and perhaps gloves? It's an interesting question, and it's an interesting question as to why some stores have not wanted their workers to wear protective items. It seems to me that if we're gonna, again, in these places where there would seem to be, of the public places that remain open, it would seem grocery stores may pose one of the issues that we need to really pay attention to in terms of stopping the spread of the virus. It stands to reason that employees should have to wear masks, but what about customers? We talked about this yesterday too. There are some stores that are, Walmart, for example, is now taking temperatures of all its associates when they come to work, but should stores, be requiring customers to have masks? Apparently the city of Miami Beach is now doing that. That's the type of thing that's going to come to more and more communities across Florida. I got a email yesterday from Chris England from Martin County. This is actually an open letter he sent to Governor DeSantis, copied it to me and some other folks as well, but it's interesting. It talks about the issue of the homelessness, and the impact of the COVID-19 crisis. He said, "We must put our homeless population into our empty hotels immediately. As a volunteer with homeless veterans for the past 8 years, I have come to know that these, our unsheltered friends, are at great risk for COVID-19 and are a prime pathway for the spread of the disease. Many are in poor health to begin with. They lack the means to keep clean. Lacking shelter, they will wander. Some have mental health issues. They are human beings. Their lives count for something. I beg you not to turn a blind eye to them for their sake and the sake of public health in Florida. Please see that they're put up in our empty hotels." So a number of organizations that deal with the homeless, that help the homeless, they are continuing to be out there on the front line, sort of providing them with food, doing what they can for them. We don't know to what extent the people who have been infected in Florida, the confirmed cases of the virus, are people who may have been homeless, because again, the data that we get from the Florida Department of Health is not that granular. All we know is that the people are of a certain age, they're from a certain county. We don't know what areas from the county they might be from. We don't know anything about their ethnic background. We don't know of their status in terms of whether they have a home or whether they're homeless. So it would be interesting to find out, to what extent has Florida's homeless population been affected like this. Florida, particularly over the winter months, has a swelling homeless population for obvious reasons. It's a decent place to be homeless, right? The weather's okay. You're not freezing to death like you would be up north. And, Chris is right, though. The homeless tend, obviously, for obvious reasons, to not sort of keep up with as many sort of the hygiene things, with a number of sort of other issues that they have that prevents them from maybe taking effective measures to prevent the spread of this. And health workers do what they can to sort of spread the message among that population. We don't know, though. We don't know how big of an issue this is for them. We don't know if the homeless have been hit harder or as hard as any other community. Again, here's where additional data from the health department would be beneficial, because it would allow us to sort of target in on the areas or the communities that tend to be harder hit by this. If we knew, for example, that the homeless were at particular risk of this or at particular risk of spreading it, then education efforts could be directed to those communities. Additional resources could be utilized, to take the message to those communities and say, look, you got to wash your hands. Look, you have to do these things. You have to wear masks, that sort of thing. But again, we don't know that, so we can't gauge the threat. We can't gauge the danger. Additional information would allow us to do that. So I got a note here too from Elaine Ketchum of Port St. Lucie, who says, "I'm a resident of the Brennity at Tradition, which is in lockdown mode. For a time, Brennity shopped for us, but now no longer do. They do pick up meds though. I did order from Publix and they delivered. I was wondering what other establishments delivered, what I might know about that." Well, as she's discovered, Publix does deliver via Instacart. So does Aldi. Aldi actually also delivers via Instacart. Winn-Dixie delivers via Shipt. Instacart and Shipt obviously being these services that deliver groceries for you for a fee. Walmart does not deliver locally, but you can pick them up. But the problem with all of these services is that delivery times are through the roof. Obviously, online shopping has boomed as a result of this crisis. And excuse me, it takes a long time to get groceries delivered. We've heard stories of, several days out, people waiting that long for groceries or waiting that long to go pick it up at Walmart. And then, of course, you run into the issue, some things they just don't have. So You know, it's obviously much more convenient for folks, particularly those who can't get out, to get their groceries delivered. More and more you're seeing this, and it's been a boom time for, you know, these outfits that are providing the delivery, but they're overloaded, they're overwhelmed, they're looking to hire people, you know what I mean? So it'll be interesting to see to what extent online shopping persists after the crisis is over. Will we have moved permanently to online shopping? Will a larger number of people continue to shop online, even for groceries, than now, as opposed to previously, before the crisis, when they could just go to the grocery store and not have to worry about it? This crisis is going to change our behavior in a whole lot of ways, okay? And it's going to change our economy in a whole lot of ways. It's going to destroy the economy in some respects, but there are other aspects of the economy, such as the grocery delivery business, which would seem to be booming, or would seem to have a real bright future ahead. I'm just noticing now one of the comments from Robert Avalone saying, "I have no problem with Walmart pickup. Plan in advance and you'll be fine." That's a great call, right? If you have the flexibility to plan in advance, to order several days in advance, if you don't have to order today and get it delivered today, you're going to be all right. I've ordered from Walmart in the past. It's very interesting too. Sometimes if they don't have an item that you ordered, they'll substitute something for it. And often, on a couple of occasions anyway, we've gotten something that's actually better or bigger than what we ordered for the same price. Now, I'm not sure to what extent they're doing that now with the crisis sort of taxing their supply, but it wasn't a bad deal at all, But again, it's the type of thing you got to plan ahead, and that goes kind of across the board for this crisis as a whole, right? Those who plan ahead are going to be in much better shape than those who don't. I'm Columnist Gil Smart. Once again, we appreciate you being here. We hope we answered some questions for you, gave you some information you can use. We're doing this every day at 2 o'clock throughout the week, Monday through Friday. You can, if you have questions, leave them in the comments. You can email them to me at gil.smart@tcpalm.com. You can send them to me on Facebook. You can call me. My number is area code 772-223-4741. I want to remind everybody that our coverage of the coronavirus crisis on TCPalm is free. We have dropped our paywall in an effort to keep you informed, so stick with us. We'll let you know what's going on. Thanks for being here, and we'll see you tomorrow.